Most natural looking filler for fuller, softer lips. I'm 48 and my lips are losing volume with age. I'd like something that is going to last for at least 6 months, but there are so many fillers and I'm confused. Restylane Silk, Juvederm, anything else? I want to avoid the duck lip look. Also, my lower lip is quite asymmetrical, and I'm hoping a good injector can make them look more even.
Thank you for your question. You submitted a question without a photo, but in this question you're describing yourself as 48 years old, you've lost lip volume with age, and you are looking for a filler that can last at least 6 months, and you describe how confused you are between many different brand named products, and at the end of your question you state you're looking for a good injector that'll help you look natural and not have duck lips. Well, I can certainly share with you my approach to patients like yourself in my practice, and how I help counsel them in doing exactly what you want. In fact, your situation is really very common. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and as I stated, helping people look their best and deal with facial aging changes is a very significant part of my practice, and avoiding duck lips is the first thing that every patient says to me before they decide that they want to try having injectable fillers. So what you're dealing with is essentially a saturation of messaging by companies competing for your attention in terms of the best, quote, filler that is ideal for you. And so this is basically just too much information, and making a choice as a consumer is very, very difficult. This has always been something that's played for not always, but for at least a significant part of my over 20-year career, has been kind of a plague of the medical profession, in that pharmaceutical companies and hospitals and basically people beyond your physician are basically marketing directly to consumers. And although there's certain strengths to that, there's also results in a lot of confusion as to what is the best option for you. So basically, I try to help my patients understand the following. Essentially, these products, regardless of what they are essentially tools. They're tools for a practitioner. It's the practitioner who has the knowledge and the experience with these products and how they apply those products that makes the difference on what results in the best outcome for you, the patient. So one of the amazing things that I've really learned to appreciate is how strong a messaging process from any company can actually not only act positively, but can actually act negatively in the minds of a patient. A patient can come to me and say, I went to so-and-so and I had this XYZ injectable treatment, and that injectable doesn't agree with me. And so my role as the doctor, of course, is to help guide you and to say, well, if you didn't have an allergy or any kind of really unusual reaction, and allergies and any reactions are very rare with injectable fillers, I say, well, let's differentiate the practitioner performing the procedure from the product. So there is a real art to what we do, and there has to be a synergy between the patient and the physician. A lot of my patients will say, I don't want duck lips. I don't want to look like so-and-so celebrity. And I'll say, well, why does that person look like that? Well, it's because they wanted a certain look, and they had a physician who decided that that look is desirable. So there was a willing patient with a willing doctor coming together and finding this type of outcome. So the aesthetic vision of both the patient and the physician have to be in harmony. And so the patients who come to me, basically like yourself, are looking for restoration of some lost volume. So I always try to explain that the people with the so-called duck lips are having, they never had those when they were, whether they were younger or at any time of their lives. They've actually exaggerated their appearance, and they created this augmentation that was beyond natural. For most of my patients, it's about restoration or correction. So I then discuss with them what I feel is the appropriate injectable for them based on their skin type, skin quality, the tissue, and what I feel is the right tool for their desire. And that's what makes this a really great time to have these procedures. Since 2005, when Restylane was the first hyaluronic acid filler to be introduced into the market, we really have a treasure chest of choices. And with that comes a certain amount of tremendous flexibility, as well as, like a painter choosing different paints and different textures, or a sculptor, you also have a lot of options as a practitioner to really refine the results in a way that you like. And the companies have certainly been very good about developing better products and delivery methods, and we definitely have a lot of great tools. But the tools are only as good as the physician performing the procedure and having the shared communication and understanding of the desired outcome. So don't hang your hat on just one particular injection or injectable. You ask 5 doctors, you're going to get 5 different answers. Find a doctor that you feel shares what you want and you're comfortable with. And once you find that doctor, I think that you can start conservatively and develop an outcome and result that you'll be comfortable with and achieve this goal of having that 6-month longevity. And just a brief comment about longevity of fillers. There's a wide range. There's a range that the companies provide us with based on their pre-FDA approval or pre-market trials in order to establish a range, but there is still a wide range amongst individuals. Some people will go through certain fillers very fast. Other people, a hyaluronic acid filler can last a year and beyond. It just depends on, and one that's expected to last less time can last a lot longer. That's basically the concept there. So understand that there is a lot of flexibility here, and figuring out what's right for you takes some time and experience. That's why I want to emphasize finding the right doctor that you want to work with is very, very important. And unfortunately, because of this emphasis on product, a lot of times these procedures become commoditized, and people keep searching different discounted opportunities to go to somebody because something is cheaper. Possibly the least intelligent, or I would say least appropriate way to get to the right doctor. Sometimes it might work, but I would say that it's probably better to look for the doctor that you are going to be comfortable with, and just invest some time and resources to make that connection. In my practice, I have patients who have been with me for years, because even if I, let's say, do their eyelid surgery 10 years ago, they stay with me to do their injectable fillers and other procedures along the way because we click. And so I think that's a very important thing. You need to find a doctor that you click with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.